Communities of color are less likely to have access when it comes to mental health care. July is National Mental Health Care Awareness Month, and a statewide organization is launching a campaign to raise awareness and save lives. Latrice Curry has more in this Eye on Health report.
Despite advances in health equity, disparities in the mental health care community still persist in a big way, especially in minority communities, which is why Tennessee Voices is working hard to educate and empower. Organizations across the country are trying to shine a light on mental illness and its effect on minorities. The Black youth suicide rate is increasing at an alarming rate.
Our goal is with all generations, helping them on their journey to seek better mental health care and support them, letting them know that there is hope available.
Will Voss is with Tennessee Voices. The organization has launched a statewide campaign this month.
July being such a powerful month as National Minority Mental Health Awareness Month, we're raising the awareness on, well, not only mental health, but mental health of minorities.
Voss says Tennessee Voices is providing more than 15 services across the state, working with parents and caregivers of children with mental illness and trying to break down the barriers and erase stigmas attached to mental illness.
As a person of faith myself, I know that a lot of African Americans, a lot of Blacks, we rely solely on that. And my philosophy is, yes, you can have your faith, and you can also see a therapist and seek treatment during that time and have a combination of both.
A recent study by the Congressional Black Caucus shows in recent years, self-reported suicide attempts by Black teens increased by 73%, while the rate for white teens decreased. It also shows that Black children younger than 13 were twice as likely to die by suicide than white children.
And it's important that you're intervening to prevent the cause of suicide. You're changing the question of, well, what's wrong with you to what's happened, what has occurred. So we're making sure that teachers are well aware, that those educators that they're taking with are able to look out for those signs and symptoms.
Voss says this is a conversation that has to be had, and that is why they're hoping to jumpstart the conversation in a big way.
We're using our voices. We're advocating for the change that needs to occur in multiple systems and working. We have staff who are constantly researching different legislature that we can work to support and make sure that bills are in place and services are in place to bridge those gaps.
Latrice Curry with that report. Voss says Tennessee Voices is providing families and children with a safety net. They're offering telehealth visits during the pandemic and free services and resources to those in need. You can find their contact information on our website.